Hey, Dr. Tyler Williams at Better Sleep SLC. Thanks for checking out this video here today. You're watching this because you have some questions about Medicare and coverage on sleep devices or sleep apnea treatments and how all of that works. And there are a lot of crazy ideas out there on oral devices, and are they dental devices or are they medical devices? Do I get these from a doctor or a dentist? And we're here to help you work through this sometimes complex maze and figure out what option might be best for you. Now, the options we offer aren't the solution for everybody, but our success rate is very, very high. And the reason we do that is because we have a very thorough screening process and we work with other professionals who help and refer people to us that are good candidates, might be the right fit. And if we're not, we'll help get you to a service or someone else who can help, so you don't have to go back out to the internet and try to search and find somebody where you might just get lost or get told a bunch of different things. Now, the first thing to know about oral sleep devices or dental sleep devices is they are billed as medical codes, not dental. Now, there are some regular dental offices that may be able to do these devices, but we have had the opportunity after I graduated with my doctoral degree to be able to do a 2.5-year mini residency on sleep medicine. And that provided the opportunity to be able to make a device that fits on your teeth, but have a practice that supported the medical training around your sleep device. So the questions you want to ask a provider if you're getting an oral sleep device is, one, how are you going to measure and set this against my airway? Because everybody's airway is different. And to just scan a bite of your teeth and make something that fits over your teeth may or may not work. Years ago, when we first got into this, we used a lab that did exactly that. And we ran into lots of problems with comfort and fit and not being able to know if it actually worked. And so we dropped that lab because I didn't feel like it was giving our patients the best option available. So as we've continued to learn about this science, we found that sometimes people go to a dental office where they get an impression of your teeth and your bite, and they send you the device, and then they say, go back to your doctor and see if it's working. But there's no good way to follow up and test and ensure that it's, one, measured against your airway, two, what happens if it doesn't work, and three, what's the long-term adjustment plan for your device as things change. And if they can't answer those questions, then you need to decide if getting something that's really going to help your medical condition is important to you, or if finding the cheapest option is more important to you, because often those two things are not aligned. And whether we're helping you or not, we are here to help answer questions you may have. Medicare does cover oral sleep appliances. We do them all the time. In 15 years of doing this, I can't think of any one scenario when someone with Medicare was not able to get coverage for an oral sleep device. Now, that doesn't mean that it's always approved right away. Sometimes if we have to do a pre-authorization for certain Medicare plans, or you've had a CPAP in the past, or you've had surgery, the process can take a little bit longer to get the approval. But in the end, I can't think of any one instance when we were not able to get an approval. So as with insurance, from your experience, you may know this as well, it's not always super easy, but again, we get the necessary documentation and paperwork, and we've had a high success rate. There are also certain types of devices that are approved by Medicare, and there are devices that are not approved by Medicare. So you want to make sure that you're getting a Medicare approved device. And again, this is your medical portion of your Medicare, not dental. If it goes through dental, you're probably going to get a lower quality appliance and something that's not really treating your medical or your sleep apnea as well as it could, because there won't be as much comprehensive treatment. So thanks for checking out this video today. And if you have questions, please call or text us. We look forward to hearing from you, and have a great day. Thanks.